And welcome back. Well, dental implants are great for getting that confident smile, and there are many different implant options that you might not be aware of. So Dr. Roberto Monteagudo is back from WisconsinSmiles. He's going to teach us about the various types of dental implants and their benefits. Good to see you again.
Hey, good to see you. Can we go play with the kites?
Yeah, you like that?
Yeah, I
Is
love
that more
the
fun
kites.
than an implant?
Yeah, actually we were there last year and they were incredible. We had a blast.
Yeah.
So, yeah.
It is so much fun. I just think they're so whimsical and, it just gives you that childlike feeling.
Yeah, I want to see the whale.
Yeah, get inside the mouth, right? So tell me exactly what a dental implant is, because I feel like a lot of people get confused when it comes to implants and the process and what they are.
Sure. So basically what a dental implant is, it's a system where we're replacing a tooth, okay, with, in this case, for example, a titanium. Some people call it a screw. I don't like calling it a screw. It's basically a prosthesis that we put inside somebody's
Sounds
jaw.
like you have a mechanic in your mouth.
Basically. So if we look at the screen here, we could actually see how the implant goes into the jawbone. Over the implant, we place what's called an abutment, and then over the abutment, we place a crown. So basically, we're
the crown
replacing,
is the tooth.
Yes, it's the tooth that we actually see. So, and I brought here some examples of basing an implant. The last time we talked about it, I brought this really big, huge one here. I actually brought one that is actually the actual size of an implant. And they're very small titanium prostheses that go inside, again, the bone.
So we're looking over here.
We're looking at this one here. This is actually the, that one. This is basically what we just saw on the screen, where we have the implant itself, and then the abutment that goes over, and then over this we would actually fabricate a crown.
So that's just an enlarged version.
Yeah, just an enlarged version. Because actually, last time we did it, I had people come saying, "Are they really that
really
size?"
That big? No.
So we actually brought one here.
That's just to demonstrate visually.
It's a very small. It's a very small implant. So. And they work great.
So why would somebody need an implant? What are they getting them for? Is it because they had a abscess and they lost a tooth, or?
Yeah, anybody who's lost a tooth, can get a dental implant. Anybody, for example, has lost multiple teeth, and in certain cases, they've lost all their teeth and they're walking around with dentures.
Yeah.
Well, there are different type of implants that we could use, so they either don't have to use the adhesive that's used, like Polygrip and stuff like that, and a lot of people don't like.
My mom hates it. I'll tell you right now. She uses it. She hates it. She thinks it's gross.
Yeah, and the thing is that with dentures, you have to take them out every night, rinse them out, put them in a glass of water, then put them back in your mouth the next morning.
And sometimes they pop down when they don't stick well, or you can't eat certain foods.
Yeah, embarrassing moments, for example, at a restaurant or something where people are talking, all of a sudden, boom, the denture comes down.
My mom's laughed her teeth out of her mouth. Anybody who's had dentures, I guarantee they've done that before.
Yeah. So we do have systems, for example. We have a mini dental implant system, if we look here at the desk, where we could actually place implants, mini implants over.
So people can see it.
They're basically mini implants that we could place in the jawbone. And then what patients actually do, instead of using the adhesive, they actually snap their dentures into place.
Oh, okay.
So unfortunately, I forgot to bring the top portion that comes from it.
That's okay, but we kind of see this would snap over technically.
Yeah. Now this is the other version, which is called in the dental community, it's called all-on-4. Or basically, what we do is that we place dental implants and then we screw in the teeth. So the great thing about this one here, as it doesn't come out at all.
Those are permanently placed.
Yes, they're permanently placed.
Okay.
And so here's an actual.
What about food or things? Can that get underneath?
Yeah, you are going to get some food underneath, but there's a very easy way to clean it. You could use like a water pick. There's certain dental flossers that you could use. But the great thing about these type of these appliances basically is that they don't have to take it out of their mouth. Okay, they're in there pretty much permanently, and they can eat and chew whatever they want.
Can you take them out of their mouth? Do they have to come in for maintenance to do that?
Yes. From time to time, they may have to come in for maintenance, and all we have to do is, when you look at the top portion of the appliance, there's a little screw hole. We just go in with it, look like little mechanics going in and unscrewing it, and eventually taking it off, cleaning it, making sure everything's okay. We just screw it right back into the mouth, and off they go. What
is the full one that we're looking at?
This is this exact same case, but this is actually. From another patient that we had. This is basically another model, and it basically shows what these look like. Now, these are made out of all porcelain.
They really look nice.
Yeah, these are not. Yeah, these are not denture teeth.
Beautiful teeth.
Yeah, these are made out of denture teeth, and we usually use these as temporaries. When the implants are placed, we have to have a healing period, about 4 or 5 months or so, and then after the implants have healed, then we can go ahead and make the more permanent restoration. And we make it out of a material called Bruxar, and it is a high-level, very highly aesthetic.
It's gorgeous.
Prosthesis. Yeah, they look really, really nice.
Every time you talk, I'm going to open it. So tell me about them.
Yeah. So, you want me to laugh or something?
I'm just kidding.
But again, you know, the great thing about these is once they're placed in a patient's mouth, they're pretty much there, hopefully, for the rest of their life.
Well, can somebody's body ever reject an implant? Is that a thing?
There's always a chance of rejection.
And
the rejection rate is about 3%, or the failure rate is about 3% for dental implants, which is extremely, extremely low. These are made by with high-grade titanium, very biocompatible to the body. There are certain patients that are allergic to titanium, so there are other type of implants out there made of other materials, such as zirconia, and we are looking into that also. But again, it's a really good procedure for anybody that has either lost a tooth or lost all of their teeth.
Yes or no? Does insurance ever cover it?
They're starting to right now. We're playing a little bit with medical insurances to see if medical insurance can pay for it. But they're starting to come around.
So people can call, they can come and meet with you, and you'll help work through the process of what's right for them, all of that. The first 25 callers right now, you'll get a free dental implant assessment with 3D radiographs. That's very important. So 414-982-3676, WisconsinSmiles.com is the website for more. That's how you can get a hold of Dr. Monteagudo at Wisconsin Smiles. And again, those first 25 callers, you're going to get that free dental implant assessment with 3D radiographs. So take advantage of that and go see him and see what's best for you.
All right.
Good to see you again.
Nice to be back.
Appreciate it.
Thanks.